Hello and welcome to the award-winning Waterman Wellness. Your pathway to health and wellness with local experts as your guides. I'm Alyssa Hritzik. We have a lot of healthful news you can use in the December episode, including local specialists have high hopes for clinical trials being able to help their patients. A local gynecologist discusses the many options to alleviate frustrating urinary incontinence. And a Cassia woman is on the move after 2 joint replacement surgeries. You'll hear her amazing story. First, a Lake County hospital is celebrating national recognition that benefits Lake County residents. Florida Hospital Waterman is the only hospital in Central Florida to receive 9 consecutive A grades for patient safety. The Leapfrog National Healthcare Ratings Organization just released its Fall 2017 safety grades. The Tavares Hospital has received the top mark for patient safety since 2013.
So safety is key to Florida Hospital Waterman. Everyone from administration down to our volunteers all play a key role in our patient safety and the outcomes for our patients. Florida Hospital Waterman patients and the community members that use our services here, it should be important to them to know that they can walk in our doors and they're going to get the best care possible. It's not just care to them, but it's also compassionate care.
Florida Hospital Waterman was one of 832 hospitals awarded an A for keeping patients safe and meeting the highest safety standards in the U.S. You'll find more information about the hospital's safety score by visiting fhwaterman.com. Next, a Tavares specialist wants residents to know that advanced treatment for lung cancer is available here in Lake County.
Immune therapy is anything that uses the immune system to kill cancer. What you're referring to most recently, over the last probably year or two, is the new class of immune therapies. What happens with them is that they focus on a molecule, and that molecule is responsible for communication between cancer and immune system. It's one of the ways the cancer uses to tell the immune system, hey buddy, I'm part of you, don't attack me.
Janice Ambrose was in the process of moving to Florida when she learned she had stage 3 lung cancer. She was referred to Dr. Al Hazori, who prescribed an aggressive regimen of chemotherapy and radiation treatments.
I was talking to my dad in Pennsylvania on the phone, and we were both having a good crying jag. And we have this one particular person that we really dislike immensely. And I told him, I said, you know, Dad, I've decided to name my cancer because it's really hard to fight cancer. I said, when I'm sitting there getting all those medicines poured into me, I can't just think of I'm beating cancer's butt, but I can beat George's butt. And so all over my chart, both in the radiology department and at the cancer center with Dr. Al, it's George. I had my next CAT scan in March, which showed that it was still there. It's approximately about 1/3 of what it was. And just at that time, Dr. Al Hazari comes to me and says, I have some great news. There's a new drug that's just been approved for lung cancer.
And most of these medications work on those specific molecules to unsuppress the immune system. And by unsuppressing it, unmasking it, stimulating it, whatever you want to call it, it goes and attacks the cancer. And it's been tried and tested in many cancers. So, you know, lung cancer is one of the cancers that these immune therapies have really excelled in.
My CAT scans, my PET scans are now clear. I am officially in remission. I'm very, very happy and very, very comfortable recommending Waterman Hospital because you get quality care and very caring care.
You'll learn more about the advanced treatments available locally by visiting fhwatermancancer.com. After years of suffering through excruciating joint pain, a Lake County woman is celebrating her renewed mobility. Local specialists say there are many options for relief. For Natalie Windsor of Cassia, total knee replacement in both legs was the plan of action.
My right knee had gone south to the point that I didn't want to get up and walk 2 foot if I didn't have to. And I live in the country, I have a farm, and I need to be active, and it was severely debilitating. If you moved at all, you were on a pain chart of upwards of 9 and 10 every movement you made.
Windsor sought relief from Florida Hospital Waterman orthopedic surgeon Vrej Manugian.
Good candidates for surgery are patients that have failed absolutely all treatment options to the point that they can't do those things that are really important to stay healthy. So there are partial knee replacements, which is a total knee replacement on one side of the joint. And then there are total knee replacements, which is a replacement of all three compartments. Each has its advantages and disadvantages, and each should be used according to what's best for that patient after the patient, is well informed of all their options.
Dr. Manoogian performed total knee replacement on Windsor's right leg first.
So at 2 weeks I came in to get the staples out of the right knee and was doing so well that I asked them if there was any chance that they had a cancellation on a surgery date, that could we go ahead and do my left knee. And there was, and we did.
Windsor is thrilled to be able to manage her 5-acre farm again.
So have a job during the summer at a place called Camp Boggy Creek. And so it was very important that I was able to get up and get around well by June. And I was good as gold by June, after getting both knees replaced in March.
You can visit the website on your screen to find specialists who can help you or a loved one with relief from joint pain. It's not uncommon for women to suffer from urinary incontinence as they age. One local specialist wants women to know there are many options to help.
Treatments for urinary leakage, urinary incontinence, there can be a number of different things. So first we go through a history to find out what type of leakage, if it's urgency, if it's what we call stress, which is with some activity or with call for sneeze. And then from there, there is an evaluation. And the first thing I have everyone do is try to learn how to do the Kegel exercise. That's basically pelvic floor rehabilitation, if you will. We can do that both pre-op and post-op. Physical therapists do this. It's a particular area that we want women to exercise to learn how to maybe get a little bit better control, or at least some knowledge of how to control that. There's medications that we use. There's a whole myriad of different things, from what's called anticholinergics. There's even one that's available specifically for women over the counter. It's called Oxytrol for women, and they can go to the pharmacy and ask for it specifically. There are some other medications specifically for just nighttime urination or frequency or leakage.
Dr. Pillow says there are various procedures for more severe cases of incontinence. He says some of the procedures can even be done in the office. You can find a specialist to help you or a loved one with incontinence issues by visiting the website on your screen. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. A Tavares doctor shares her experience providing humanitarian aid in Puerto Rico after Hurricane Maria. A local physician explains how Lake County residents are contributing to medical breakthroughs. And the Con Recreation Health Center team has a recipe for a seasonal treat, acorn squash. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. First, you might want to check out one of these upcoming community events. We'll be right back.
It's time for the Creation Health Tip of the Month. Women who drink more than 5 glasses of water a day are 41% less likely to die from a heart attack. Create a healthier you and start your morning with a glass of water.
Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Melissa Hritzik. A Eustis specialist wants the community to know about a disease that affects a lot of people in Lake County and the resources available to help.
We have a very high population of diabetics in this county, much more than other counties. If you compare our hospital with the rest of the Florida Hospital Adventist health system, fully 50% of our inpatients are diabetics. With the other hospitals, they usually see about 33%.
Internist Stephen Tang says once diagnosed with diabetes, patients should see a practitioner regularly.
You have to remember, diabetes has many, many complications: heart disease, strokes, neuropathy, kidney failure. And so, when you can recognize the disease early, you can make sure you don't get all those complications. The hospital has a very, very good program on diabetic teaching. and they have very good programs on diet, exercise, and it's incredible how when our patients went through these diabetic classes, they really gained a lot of insight into the disease. And really, medicines only go so far. And we're very successful when the patient starts understanding the disease process and really helps with their own management.
Dr. Tang is excited about his patients benefiting from clinical trials.
Doing clinical trials contribute to medical knowledge. Basically, sometimes they involve expensive medicines that patients cannot afford, and we're able to get these medicines for the patients. We're going to be doing a clinical trial on a machine that uses electromagnetic waves to relieve pain. And we're going to be studying patients who are diabetic who have neuropathy. So that's going to probably come towards the beginning of next year. Yeah, neuropathy is it's damage to the nerve endings, mostly in the feet, from diabetes. And the way that medicine works, well, it's not a medicine, it's a device. It makes the cells undergo certain changes, and it releases chemicals that mediate pain relief.
You can find plenty of resources to help diabetics from diagnosis to management by visiting fhwaterman.com. Next, Michelle Wargo is in the Conry Creation Health Center with the Florida Hospital Waterman team. They have a recipe that will look beautiful on your holiday table, but you may want to make it year-round.
If you're looking for that something special and delicious to serve at your holiday dinner, Florida Hospital Waterman Executive Chef Dave Atkinson and registered dietitian Stephanie Bassett have just the thing, and it comes in its own serving vessel. So your guests are going to want this recipe. What is it?
We're making a roasted acorn squash with wild rice and a pecan stuffing.
Ooh, what goes in it?
We have our acorn squash that we're going to roast in the oven with a little maple syrup. And then we're going to make a stuffing with wild rice, celery, dried cranberries, pecans, onions, and some seasoning. First thing we're going to do is mix our olive oil and our maple syrup. And we've taken our squash and cut it in half and scooped out the seeds. And we're just going to drizzle some of this maple syrup and oil inside there. And then we're going to roast this for about 30 minutes.
So while that's in the oven, why is acorn squash good for us?
It's a really great source of potassium and vitamins A, vitamin C, and then fiber as well. And this is a really healthy alternative to like a traditional holiday meal that you would serve at a party or a dinner.
And it sounds like it's going to be filling with all the stuffing too.
Yes, it's going to be a very hearty meal, and it's all in one serving vessel.
Yes, I love that. All right, so what else do we have to do while that bakes?
Okay, while the squash is baking, we're going to saute our vegetables. We have some onions and celery. And while that's finishing, we'll go ahead and add the rest of our ingredients to the bowl. We have cooked wild rice. So we've added our dried cranberries, chopped pecans. We have thyme. This is dry thyme, but you can certainly use fresh thyme. And then a little bit of balsamic vinegar. Okay, so our vegetables should be nice and tender now. We're just going to fold those into the rice mixture. We're just going to give it a quick toss. So let's go check on our squash and see how that's going. So it's been about 30 minutes. Squash is nice and golden and soft. And then we're simply gonna...
Oh, so you don't mash it up or anything?
No need to mash it.
That's good.
If you'd like the stuffed acorn squash recipe, visit watermanwellness.com. Finally, a Lake County physician shares her story about helping patients in hurricane-ravaged Puerto Rico. Dr. Gretchen San Miguel was part of a small team that brought humanitarian aid and medical expertise to a community seemingly cut off from the rest of the world.
So our primary focus were the people in the center of the island, which is a very mountainous region, and it was 2.5 weeks in after Hurricane Maria. A lot of these people still had no running water, electricity, or access at all to any medical professional. Access is difficult, very difficult, up the mountains, and it's usually one street that goes up, and if the debris was covering that street, you would be isolated in that town or municipality, and there was no way of getting them to the clinic because of their current situation. We also saw people who had active fractures and active sores. There was 2 physicians, we and myself with 3, and then we had a registered nurse, wound care specialist from Florida Hospital Waterman. We would have tables and all the materials that we needed there to see patients. The week before, the government of that municipality had let patients know that we would be there. So they were ready and expecting us. At those clinics, we would see roughly about 100 patients a day. A lot of people had not been able to get refills on medications. So something as simple as treating a patient for blood pressure could mean a stroke or a heart attack because they hadn't been taking their medications for 2.5 weeks.
Dr. San Miguel credits generous community members for making the trip possible, including a local hospital, a local sheriff, and an Orlando attorney.
Thanks to John Morgan, I got that plane. We actually contacted the health department in Puerto Rico and asked them what the greatest needs were on the island. And they sent us a list, and Florida Hospital Waterman was able to give me all those supplies. So we knew that if we were going to take our own supplies, we would need security. And thanks to the Lake County Sheriff's Office, we were provided with 2 of our very own Lake County Sheriff's SWAT team members. We were a team of 7 who met for the first time on the tarmac. Our relationship within 24 hours of doing what we did and the way we did it, we became family. It's really important for the people to understand that the need in Puerto Rico is very real, and what they see on the news and what they've seen on Facebook and social media is real. The need is still there, and that there will be needs in the months to come from a medical standpoint.
Visit the website on your screen to learn more about efforts to help Hurricane Maria victims. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the January episode right here on Lake Sumter TV for some of the following stories. Lake County prostate cancer patients are benefiting from advanced radiation treatment. We'll explain. Learn how nutrition can play a role in patient outcomes during cancer treatment. And find out how some patients get back on their feet after spending time in the pool. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Melissa Hritzik for the award-winning Waterman Wellness.